My name's Diane Franey, and we're on Girard Drive in East Hampton, and I work in East Hampton as a registered nurse. I visit patients in their home. I'm a visiting nurse. It was very challenging and very stressful, but I did it. When we called patients in the morning, we had to talk to them and ask them questions about their temperature, if they had been exposed to the virus, if they were vaccinated once the vaccinations came on. So there was a conversation that had to take place. It wasn't just quick scheduling visits. We had to kind of get into some depth questions without even meeting the people. And then I had to learn all about the equipment, the doffing and the donning of the equipment. Getting the equipment was a huge problem because my office is in Farmingdale, which is about an hour and a half, 2 hours away. They didn't have the equipment. And so it was very nerve-wracking in the very beginning, wondering what I was going to wear when there was nothing to doff and don. I was afraid, but I was determined to do it. It just seemed like it was not right to pull out of nursing and not work. It just seemed like, even though I was frightened, to go and do it anyway. Family was more afraid. They made me nervous. My daughters are nurses up in New Hampshire, and they knew that I was over 65, and they felt that I should quit immediately. And they put a lot of pressure on me to stop nursing entirely. But I didn't. I just felt that wasn't the right thing to do and that I could do it. I think maybe 6 months before COVID, I had changed the way I worked. I had kind of cut back a bit on my hours, but it was not related to COVID. I had plans on retiring. I would say it was my first patient that I had with COVID. He was a young man. He was only in his 30s. He'd been on a ventilator for 2 weeks at Stony Brook University Hospital, and he came out, and I didn't have much warning that I was, like maybe 4 hours before I was to go see him, I was told to go see him. So it was all of a sudden, came on very quickly when I had to see the first patient. And, I didn't get that much direction from my work, which made it very stressful. And, I had to go into the house, and, he'd been very, very ill with COVID. So that was the hardest, I would say, hardest patient to see was the first one. There was some training that would go on. Once a week, we had a call-in number that we could call in. It was an open conversation with our managers and the people higher up in the organization. And I'd say that was very helpful. You could ask any question that you wanted to. First, they would give a little speech and give an update on how many patients we had, how many of the nurses were down. There were a lot of nurses out sick with COVID themselves. So we would get like an update on how many people were ill. And then it would be open up to questions. And they were very good about, not making you feel uncomfortable for the question that you asked. Some of them were very basic questions that people were asking, and the conversation went on for over an hour, and there was no rush to let's end this call, and I found that very helpful. When I knew that I was seeing a COVID patient, I would make it the last patient of the day. There was a lot of concern about seeing a patient who had COVID and then going on and moving on to somebody else who was, a lot of people I see are fragile, they're elderly, they were at risk themselves. A lot of them had COPD and respiratory problems, and I had a lot of anxiety of seeing someone, so we would see that person at the end of the day. These N95 masks that everybody talked about back then, there's 3 sizes, small, medium, and large. And in order for the N95 to really be effective, you have to be tested. You have to have, it's called fit tested. I had to drive to Farmingdale and get fit tested, and then they gave me one mask that I had to keep in a brown paper bag and hang it up inside my car, bring it into the house at night. All I had was one. So it would dry in the brown paper bag because of if you're using it, it collects moisture and stuff, so I would have to bring it inside the house, and that was a whole nother precaution, as well as all the equipment. And there was all this stuff about contaminated, not contaminated. So I had to set up in my car. Well, first I had a big COVID box with all the like COVID things that I would need. PPE, it's called, the whole PPE, thank you. And then I set up a dirty box. And this was actually information my emergency room daughters told me to do, which was very helpful. So I had a whole dirty box so that when I came out, there were certain things that I had to take off in the home and leave in the home, but there's certain things you just can't take off, so you have to walk out, and then I would go immediately to my car, remove the stuff, put it in the dirty box. And so it was really complicated in the beginning. What's clean? What's dirty? What did I touch? And I could go on and on about all that we had to do and how nerve-wracking it was in the beginning. And to think it through. Where do you put your car keys? You know, that was a whole big issue. Do you bring your laptop computer into the house? You know, where do you put it? I did have friends who basically said, you know, until this is over, Diane, we don't want to see you anymore. I also had one of my daughters and her husband actually moved into this house with me. So luckily I have a separate room, and I moved into that room so that I could, that has its separate entrance and exit, so I could enter and exit the home separately from, because she had small children with her too. I would sort of live in a back room of my house, and when I would see a COVID patient, I would come home immediately and take a shower before I would join the family, like for dinner or something. I always wear a mask now. I never did before, only if the person, you know, had some sort of respiratory illness that, you know, you needed to wear a mask. Now I wear a mask all the time. And I will from now on, even if COVID goes away, I will always wear a mask. Not an N95. I saved that because we had so few of them, and I'm much quicker to put on gloves now too, I would say. Caring. Yeah, that I had to continue caring for patients, that patients needed to be seen, and so I need to care for them. So I would say caring.